carers or family members, it may be that their sight loss is actually hidden and it's not been picked up, it's not been diagnosed because of a variety of reasons. So that's what the statistics say, but potentially it could be a lot more. So over 2 million people in the UK living with sight loss. Then if we think about the sort of age, related conditions and the risk of living with sight loss, 1 in 5 people over the age of 75 are living with sight loss. And what would you say is the sort of age group that you would be working with? Is it a lot more that sort of elderly age group, or potentially a huge variety as well? So thinking about, the people who you would be supporting and coming into contact with, are they in that sort of older age group? Then potentially they're more at risk of developing sight loss and those age-related eye conditions as well. And then the statistics around about sight loss and dementia, they say at least 250,000 people are living with sight loss and dementia, but it can be very difficult to distinguish, what's this with regards to the symptoms. Is it the dementia that's causing the symptoms, or could it be potentially the sight loss? And that's when there can be some confusion. And sometimes someone living with dementia and sight loss, it can add to their confusion as well. Because if you can imagine someone who maybe does have poorer sight, if they're not seeing someone walking into their room, then potentially, the people around about them will say, oh, Lindsay's starting to not recognise people, she's forgetting who it is, it's due to her dementia. But actually, in fact, it may be due to the sight loss. And that's why it's so, so important for us to know if someone is living with sight loss, what's their level of vision, how does it impact them? So then we can, provide the best support possible. And then people with learning disabilities experience higher incidences of sight loss and are also at a greater risk of developing dementia as well. Does anyone know how many times more likely people with learning disabilities are to be living with sight loss than the general population? Any guesses how many times more likely people with learning disabilities are to be living with sight loss? Anyone want to? So Kate's saying about 20 times, Helen's saying about 5 times. Okay, so it's actually 10 times more likely. So people with learning disabilities are 10 times more likely to be living with sight loss than the general population. And I'm also a registered optometrist. And when working in practice, you think, well, maybe why are we not seeing, so many more people with learning disabilities accessing eye care? And again, that could potentially be because the sight loss is hidden or it's not been picked up, particularly if someone does have a communication difficulty, and if they're not able to maybe describe to someone what their level of vision's like, they maybe don't have any verbal communication at all. So that's why we're trying to raise awareness of those potential signs of sight loss as well, so that it's picked up as early as possible, because the earlier the better, then potentially it could be treated, or sight loss, the progression could be slowed down as well. So the earlier the better. Okay. So that's the sort of statistics out the way. For those of you who like the numbers, that's the statistics out the way. If we think of our common causes of sight loss, then I was going to ask you that quick question there before I put up the slide. What do you think are the 5 leading causes of sight loss in the UK? You may have had a quick glance there of the slide when I switched it over. What sort of eye conditions are you coming across most, do you think, with the people that you're supporting as well? Yep, Tracy, have you got your hand up there?
Sorry, I didn't take my mic off. Diabetes.
Diabetes, yep, you're right, Tracy. So that's one of the leading causes of sight loss. It would be the conditions related to diabetes, so the eye conditions related to diabetes. And that's why, we always say that anyone, living with diabetes, making sure it's as controlled as possible, making sure that they are attending their diabetic eye screening as well is so, so important, because they are more at risk of developing, particular eye conditions in relation to their diabetes. Thanks for that, Tracy. Yep, and Claire's saying diabetes as well. Yep. Is it Dion saying sugar? Were you saying in relation to diabetes as well there, Dion?
Yes.
Good. Yeah, great. Yep. So sugar levels can definitely, have an impact on someone's vision as well. And if the diabetes is not that well controlled, then sometimes the person's vision can be variable as well. So they may wake up one day and they think, oh, my vision's really blurred, and they may struggle to even get around their own home. Whereas the next day, their vision may seem that a bit better. So depending on the sugar levels, that can have an impact on vision as well. Caroline saying glaucoma and cataracts. Yep, they're another two of the leading causes of sight loss in the UK. If you're mentioning, yep, glaucoma, cataracts, macular degeneration. Yep, so Helen's saying that, and Jeannie as well. Macular degeneration is one of the leading causes of sight loss in the UK. So that's one that you'll probably have heard of, and maybe have supported someone in the past who's living with that. Yep, good. Okay, so we're going to talk briefly about each one. We're not going to go into a whole lot of detail, but just so you're aware of the differences and the way that the eye conditions can impact on someone's vision. So these are the 5 leading causes of sight loss. So the first one there being uncorrected refractive error. You might think, what on earth is that? All that means is the person may have a focusing problem, a focusing difficulty, and that could be that they're long-sighted, short-sighted, or they may have a condition called astigmatism, where the eye's more rugby ball shaped rather than round. So they need a prescription to correct that. But if someone's not wearing the correct prescription or not wearing, their glasses, then they are going to be living with sight loss. Age-related macular degeneration. So does anyone know how that could impact on someone's vision? Age-related macular degeneration. Does anyone know? So I've got images up here on the screen of a clock face and what it may look like to someone with these certain conditions. Now, remembering we're talking about each one individually, but someone actually may have, more than one at a time. So the impact of, various eye conditions on their vision, we would have to consider that as well. But with age-related macular degeneration, just as it says, it's an age-related condition. It affects the macula in the eye, and that macula starts to degenerate. Okay, so the macula at the back of the eye is the area that we use for all our central vision. So when you're looking at the screen just now, it's your macula that you're using. So if that macula is starting to degenerate, then you're going to have blurred central vision with this condition. So it could be a hazy or distorted area right in the centre of your vision. And that could just start off very slowly, or it could be quite a sudden deterioration depending on the type that the person has. So if it's the wet or the dry type. So the first clock face here on the left-hand side, the bottom left, where there's a black sort of blurred area in the centre, for some people with macular degeneration, that may be how their vision looks to them. So anywhere they move their eyes, anywhere they turn, there could be a central blur there. So if you can imagine, how would that impact on someone? A whole variety of things. It could be, reading. It could be, recognising faces. It could be even mobility, recognising areas in their environment. They may be missing things. And as well, they may miss facial expressions. So they may not notice if someone's angry or happy or sad if they're not verbalising that as well. So it can really have a huge impact on someone's sort of day-to-day life if they're living with macular degeneration. So it's important that that's picked up as early as possible. So potentially it could be treated depending on the type, or the progression of it slowed down. And some people may need specific aids and adaptations put in place to try and maintain as much independence as possible. The thing to remember about macular degeneration, because it affects the central vision, if the person doesn't have any other eye condition, they would still always have their peripheral vision. So they would still always be able to see out the sides of their vision. And that's why some people with macular degeneration may actually look away from you to see you, because they have to look away from things to use their peripheral vision to be able to see something. It may not just be as clear as looking straight ahead with good central vision. So if someone's talking to you and you're thinking they're not even looking at me, it may be that they're looking away from you to be able to see you. Okay, so remembering things like that as well. So there's lots of different things, to consider, and there's more information about that condition on our website as well. Cataract, again, many different types of cataract or causes. People can be born with cataract, it can be age-related, it can be due to certain medications. But in general, most of the types of cataract would cause a sort of haze or mist over the person's vision. My gran's had both her cataracts removed, and she said it was like looking through a dirty window all the time. She just wanted to rub her eyes. It was just like misty all the time. And that's because the lens inside the eye has become a lot more hazy and misty. And that's why for some people, they can have that hazy, misty lens removed with the cataract operation, a clear lens put in place, and it could potentially improve their vision if they don't have any other eye conditions. But again, that can have a huge impact on someone's day-to-day life, depending on the level and degree of cataract. So that's a hazy, misty vision. Glaucoma, again, different types of glaucoma, but remember, glaucoma can start to affect your peripheral vision. So different to macular degeneration, glaucoma starts off affecting your vision at the sides. And that can start off very slowly as well. And that's why at your routine eye tests, the peripheral vision would be getting checked, maybe with a visual field test, for example, and the health of the back of the eye would be checked, because glaucoma can affect the optic nerve in your eye. But glaucoma can eventually mean that someone has no peripheral vision at all, so a bit like tunnel vision. And then end stage glaucoma, the person could, become completely blind. So again, depending on the type of glaucoma would depend on the person's level of vision. And then diabetic eye disease, like we said, the diabetes can impact, on the person's vision. It can be quite variable depending on their sugar levels, and the diabetes affects the retina at the back of the eye. So it's where all the blood vessels are, and those blood vessels can become leaky, and there could be potential hemorrhages there if they're becoming leaky and fragile, and that can be due to the diabetes. So that's why people who are diabetic are advised to go for a diabetic eye screening regularly, so those changes are picked up as early as possible, and then potentially the vision could be saved, or the progression of sight loss could be slowed down. So that's a very brief overview of some of the common causes of sight loss in the UK. But as I say, it's important to remember that it's such an individual thing, and sight loss can impact on everyone so differently. But there's lots more information on that on our webpage. I'm now going to show you a short video here. This was about a campaign called #HowISee. And it was just really to demonstrate that sort of spectrum of sight loss and how it affects everyone so differently. So let's have a listen to this video, and then we'll discuss afterwards.
Having sight loss is not black and white. 93% of us who are registered blind or partially sighted can see something.
My eye condition is glaucoma, and if you imagine in my left eye I have no perception of light at all, so it's completely black. And in my right eye, it's almost like I'm looking through a really murky, kind of watery fog machine, if you like.
It's like as if there's a mist or a fog In the evening, the dusk, or at night, I have no vision at all.
I have Usher syndrome type 2. That's a combination of hearing impairment and retinitis pigmentosa. The most common misconception about my sight loss in particular is that I don't look blind.
I can see more at the side of my eye than the centre of it. I tend to sort of shake my head from side to side, so I'm doing that and then doing that. When you tell someone that you're registered blind or severely sight impaired, they think that you're completely blind, have no light perception, no colour perception. But when you tell someone you're partially sighted, they think you can see more than you can actually see.
I am registered as partially sighted due to having cerebral palsy. I have loss of some of my peripheral vision. I can see like the different colours, but they tend to be like colour blobs. I feel that I'm very independent and can achieve anything that everybody else can do. I just have to do it maybe in a slightly different way to other people.
I have macular degeneration. I can't see your face now. There's just a big round blob there, and I have double vision as well. The first couple of years were horrendous. It was like a bereavement, really. I was so afraid. I might cry. People are absolutely brilliant. But without the white cane, I would not be as confident. Oh, the freedom of living is brilliant.
In the UK, more than 2 million people are living with sight loss. Being registered blind doesn't mean you can't see anything. There's a whole spectrum of sight loss out there, and that's what people need to know about.
Share our film, #HowISee.
RNIB, supporting people with sight loss.
Okay, so that I think just hearing, from people who are living with sight loss just has that huge impact as well, and hearing from the sort of lived experience. Does anyone have any comments on their thoughts on that video, what we heard there? I think it is just
Hi
that
there.
variety. Oh, sorry.
Sorry. It said, can you find that on YouTube, for example? So if I wanted to share it with the team, that's what I'd search.
Yes, yeah.
Okay.
If you just search #HowISee, there's actually a few other ones as well there, Kate. So there's a variety there that you can watch. But yes, #HowISee, even if you put that into Google, it would come up with maybe the RNIB page about it as well. Yeah,
Perfect.
that's
Thank
super.
you.
Thank you. But yeah, so there's a whole host of ways, someone's vision, it could be impacting them. And like that lady said towards the end of the video, that emotional impact as well. So not only maybe physically, but also emotionally, psychologically, it can have a huge impact. And it's about knowing, how does it impact on that person and what support's available. And there's a whole host of services and support out there, that people can be signposted to or referred to. And it's about knowing what is out there and how do we access them. And I'll show you some examples of that at the end of the presentation here. So I just wanted to mention as well a wee bit about hidden sight loss, because it may well be that you're supporting someone who maybe has communication difficulties, who maybe has, poorer understanding, and potentially they may be living with sight loss, but nobody knows. And that sight loss could be hidden. And in particular, some people with complex needs may not know that they have a sight problem and may not be able to tell people. And people may think that the person can see perfectly well. And just to give you an example of that, there was a gentleman in a service who we were working with, and staff and family members around about him thought, he seems to see perfectly fine some days. If a sweetie's dropped on the floor, he'll go straight away and pick that small sweetie up. Whereas the next day, he really struggles even with walking from one, position to another within a room. And actually, with his level of vision, his level of vision came under the criteria of being able to be registered as blind or severely sight impaired, but he had a small area of useful vision on the top right-hand area of his right eye. And actually, in certain head positions or the way he looked, he was sometimes able to use that small area of useful vision. And that's why it's, so important to know what is the person's level of vision, how best can then we support that person. Because it's really helpful to know, if someone has only vision to the right-hand side, for example, then only approaching them from the right-hand side, so they maybe don't get a fright if you're approaching them from the other side. Or if you're setting cups of tea down, making sure they're in the position where that person's able to see. So I just wanted to highlight that sometimes it can be hidden, it can sometimes be disguised in many ways, and some unusual behaviour may be a coping strategy relating to the person's sight on an attempt to make the most of their useful vision. And like that gentleman said in the clip earlier, it could be like head movements. So he had to move his head from side to side. Someone may start to do head movements, and that's to allow them to see. Or it could well be that they start, you know, having to use their hands and using that sort of tactile touch to know whereabouts they are in an environment. So it's thinking of those other signs, you know, is the sign highlighting a potential visual problem as well? And then maybe asking the person if that's suitable, you know, how's your vision? Have you had a recent eye test? And seeing, you know, if they mention anything there as well, if they're able to communicate that to you. So I just wanted to highlight that there. And I won't play the wee audio clip just now because I just played the video, but that's just highlighting the importance of understanding, you know, signs of sight loss as well, which we've got further information on and we'll forward on. CVI, has anyone heard of CVI, cerebral visual impairment or cortical visual impairment? So this is one I just wanted to highlight as well, because for some people living with complex needs, they may be living with CVI, and that's when the visual impairment is due to the brain and not necessarily the eyes. So the person may have healthy eyes, and when they go for their eye test, the optician will say their eyes are healthy, their vision seems fine. But then when you go home, that person's really struggling with day-to-day tasks. And it could well be that it's the brain that's affected. Because to allow us to see clearly, we not only need healthy eyes, but we also need a healthy brain. And a lot of the visual processing happens towards the back of the brain here in our occipital lobe. So there's lots of visual pathways that need to work well and be healthy to allow us to process what we're seeing. And if our brain is not able to process what we're seeing, then that can cause, you know, potentially a lot of frustration or anxiety in the person as well, if they're not able to process what they're seeing. So if you can imagine, just to give an example of this, if you were in a busy environment, you know, say for example, it was a cafe you went into, there was lots of, you know, tables, there was lots of things on the tables, cups, saucers, food, there's lots of people walking about, there's posters up on the wall. That's a lot of visual information, isn't it, to try and process. So you've got colours, shapes, not only that, you've also got all the noises and all the other sensory information there. Now, someone with CVI, they may really struggle in an area like that, that's busy, that has a lot of what we call visual clutter. So there's a lot of visual information for the person to process. And if they walk into that environment, they may feel, you know, overwhelmed. They may feel frustrated, they may feel anxious, they may actually not even want to go, and they just walk straight back out the door because it's just too much for them to process visually. And they may even find that if they sat down at a table, they would find it difficult to even find the cup because there's a lot of information on the table. There could be, you know, the menus, there could be adverts, there could be a vase of flowers. And for someone, that visual, you know, processing can have a huge impact on their day-to-day life. So I just wanted to mention that briefly, that someone may be living with CVI, which could be, you know, it's impacting on the brain, but their eyes may be healthy as well. So that's one to be aware of. And as I say, there's lots more information online about that as well. And I could talk all day about that one. It is, you know, it is interesting. It has a huge impact on people living with CVI. Okay, so briefly, we wanted to mention about falls. And of course, someone living with sight loss is more at risk of falling. And in fact, someone living with sight loss is twice as likely to fall. And then someone living with dementia is up to 8 times more likely to fall than someone without the disease as well. So again, it's so important that someone is accessing their routine eye examinations, that, you know, their sight's been assessed, their eye health's been assessed as routinely as possible. And if you notice that, you know, someone does have an increase in falls, has their eyes been assessed? Has their vision been assessed? Because that's so important, that as part of a falls assessment, that someone's sight loss, you know, or vision has been assessed as well, to ensure that that's, as, you know, as best corrected as best possible, either with glasses, or if they're living with an eye condition, that, you know, that's potentially being treated if possible as well. So the impact on falls can be huge if someone's living with sight loss. Registering or becoming registered. So Vicky asked me just to mention a little bit about the sort of process of this, and there's more information on the website as well. But bearing in mind that not everyone wants to be registered as well, not everyone maybe wants that sort of label of being registered blind or partially sighted or severely sight impaired or sight impaired. But it's important to know, you know, what is the process for that. And if someone does become registered, that then means that they may have more access to certain, you know, benefits, or reduction in, you know, TV license costs, or costs towards their glasses, or public transport. You know, there's different things like that, and there's more information on our website. But remembering that actually 93% of people who are blind or partially sighted can still see something. So again, try not to assume that if someone's registered blind, that they're completely blind. They may still have a small area of useful vision. It is the ophthalmologist at the eye clinic who can decide if someone can be certified, and it would be them who complete the certificate called Certificate of Visual Impairment, or CVI, another abbreviation of CVI, but it's Certificate of Visual Impairment. And what happens is, at someone's eye test, the optometrist may, you know, they would be assessing the person's central vision as well as their peripheral vision. So it takes into account central vision and peripheral vision, whether or not they would come under the criteria of being able to be registered. And then the ophthalmologist, they would be referred to the eye clinic. The ophthalmologist then discusses that with the person. If they can be certified, they would complete that certificate. And if the person's happy to be certified and registered, that certificate's then sent to the local social services department. And within that social services department, there would be a sensory impairment team or sensory services team. They may have slightly different names depending on your local area. And that sensory team would then contact the person to ask if they wish to be registered. Okay, so it's a criteria that takes into account central vision and peripheral vision. It's the ophthalmologist at the eye clinic at the hospital who can decides if someone, excuse me, can be certified. They complete the certificate. It goes to social services, and that sensory impairment team would contact the person to ask if they wish to be on the register for blind or partially sighted people. And then that way they may, as I say, be able to get a whole host of different benefits as well. And there's more information on our website there. So that's a brief overview of the sort of process of that as well. Okay, any questions so far? I'm aware it's such a huge topic, isn't it? And it's just a brief overview of lots of different things, but hopefully it's been interesting and helpful so far. Now, I just wanted to mention some examples of how the environment can have an impact on someone living with sight loss. So I've got up here, you know, sort of 6 different images here just to talk through briefly. And you know, for you to think about some things that may have an impact on someone living with sight loss, who you may come in contact with or be supporting. So the first one here on the left-hand side is my colleague Ian, who's standing against a cupboard there with the eye charts in the background. The cupboard's bulging with things. There's a box on the top. Ian's wearing a checked shirt with his lanyard with a few badges as well. What sort of impact could that have on someone living with sight loss? or potentially visual processing problems. So have a think. You can pop it up in the meeting chat if you want there as well. What sort of impact that may have if you think about some of the things that we've just spoken about already this morning. Yep, so Kate's saying it's very busy visually. Exactly, Kate, yep. And you know, if your eyes are healthy and if your visual processing in your brain works well, you may not necessarily think about that all the time. But actually, for someone with visual processing difficulties or living with sight loss, there's a lot of information there to process. And if Ian's trying to communicate to that person, they may really struggle to communicate with them because of all the visual information around about them. Not only is there the letters on the eye chart, there's the information behind them, there's his checked shirt with all the colours and the patterns, also in his t-shirt, there's the lanyard with the badges, you know, there's the facial expressions. So there's a lot of information there to process, and for someone that might just be too much, and they may really struggle to then communicate with Ian in this situation. So that's why we need to consider our environment. You know, if we're trying to communicate with someone with sight loss and complex needs, if they do have a visual processing difficulty, it may well be that they will struggle in busy environments. And that can be, you know, especially for people living with dementia, depending on where it's affected the brain, it could affect how they're processing what they see as well. And they may have difficulties processing that visual information. And it could be things like a busy carpet. So in the bottom image here, where there's the chairs and the sort of pattern on the carpet, a busy carpet like this, for somebody to visually process that, again, they may find difficulty with that. And they may have difficulty with what we call depth perception. So how high or low steps or curbs are. And if they're seeing lines and patterns, they may not know if they're higher or lower. So they may actually find that actually walking on a carpet like this, they're struggling to see, is that flat, or are there bumps or hills in this area? Are there steps? They're maybe not sure because it's a lot of information to process. So think about your environment. You know, is it a busy environment? Could it be that when you're talking to someone, could it be in a quieter area with less visual information, if possible? That may make a difference to the person. And for some people with visual processing difficulties, even what we're wearing can make a difference. So if we've got a busy shirt like Ian here and t-shirt with lots of patterns, the person may struggle to process all that. They may struggle to even then communicate with you. So thinking about our clothing, and I'm not saying go and buy a full new wardrobe of plain patterns, plain coloured clothing, but just think about, you know, our environment and include ourselves in that and what we are wearing as well. Okay, the top picture here along to the right from the one that I described is just showing that round pink mat at meal times with the cutlery against it. But you may notice that that's quite well contrasted. So we talk a lot about things being well contrasted for people living with sight loss, and that can make a huge difference to their independence and their safety. You know, if something is well contrasted, they're more likely then to see it, depending on their level of vision, obviously. And even something as simple as, you know, thinking about the colour of food on a plate, or at meal times, is the cutlery contrasted against the table, then they may be more likely to be more independent at meal times as well. The one below that image is an image of just the bare bulb coming from the ceiling with no shade on it. And again, we talk a lot about lighting when we're thinking about sight loss and the impact lighting can have on someone living with sight loss. If someone doesn't have a shade on their bulb like this, then that can sometimes create a lot of glare, and glare isn't good. You know, it's going to create a lot of problems for someone living with sight loss. For example, if someone's living with cataract, sometimes the brighter the light, the worse their vision is, because that hazy lens where the cataract is, if there's more light coming into the eye, it can cause a lot of glare and it can cause their vision to become even more sort of blurred. So having, you know, appropriate lighting, and that's when being in touch with the person's sensory impairment team, you know, having that referral there with appropriate consent would mean then that the sensory impairment team would do a needs assessment, and they could suggest different, you know, appropriate lighting for that person and their eye condition, so that they're making the most of any vision that they may have currently. So lighting can be a big issue. And then you've got things like, you know, environments where it should be an accessible area. So this disabled toilet here in the image at the top should be an accessible area, but actually it's used more like storage where there's lots of boxes. So thinking, you know, are there obstacles in the way? Someone living with sight loss may not notice those obstacles, and that puts them more at risk of falls as well. So thinking about accessible environments. And then the last image on the right-hand side was an image of a young girl's bedroom where she actually used to always go for a nap during the day. This young girl was living with sight loss and a learning disability. And they had rearranged her room a little, and she was refusing to go to her bed at this time of day. And they wondered why it was. Eventually they figured out actually this patch of light on the floor, that she actually thought it was a whole puddle of water, or potentially a hole sometimes, depending on where the light was focused in on the carpet. So again, what environments may look like to you, it could look completely different to someone else. And shadows, for example, on a carpet could look like steps or stairs to someone else who maybe has poorer depth perception or visual processing difficulties. So that's just some examples, you know, thinking about visual clutter, thinking about colour contrast, thinking about lighting. All those environmental things can have a huge impact on people living with sight loss. Okay, so what support is out there? There's a whole host of support and services out there. And it's important to know what's on your doorstep as well. You know, locally, what's there, what's available. There's a professional known as Eye Care Liaison Officer. Don't know if anyone's heard of that, or an ECLO for short. Now, an Eye Care Liaison Officer, I think there's about over 100 in the UK now. They're mainly based at the eye clinics, but the person doesn't have to be accessing the eye clinic to access their support. And they can provide a lot of practical and emotional support to someone living with sight loss. And they can also be that sort of bridge between, you know, healthcare and social services as well. And they can make many different referrals for that person, and not only in relation to their sight loss, but potentially their other needs as well. So it's good to know who your local ECLO is, you know, make contact with them, let them know what your role is as well, because it may well be that they can refer some of their patients to you, potentially. You'll know better than me if that would be something that's suitable or not. So know who your local ECLO is. How to find that out? The best way, I would say, is to go onto the Sightline directory, and I'll give you the link to that as well. But Sightline directory, you just pop in your postcode and you can type in ECLO, and it would come up with your nearest ECLO. And then, of course, you've got the sensory impairment services. Now, there's professionals known as ROVIs, Rehabilitation Officer for Visual Impairment, that they're now known as Vision Rehabilitation Specialists. So their titles changed a little, but that's your local sensory impairment services. And again, they can sometimes provide a lot of aids or adaptations for the person to try and maintain as much independence as possible. And sometimes it's the smallest aid that can make the biggest of differences for someone. Even something as simple as a liquid level indicator, like the image on the bottom right hand image here, where it's the wee yellow piece of equipment sitting on the edge of a cup. The metal prongs are in the cup, so the person living with sight loss, if they're pouring hot liquids, they may not be able to see how high or how low the liquid is. As soon as it touches the metal prongs, it starts beeping and vibrating, so the person can hear or feel the vibrations, and they know that they've filled their liquid up to a safe level there. And that way, you know, aids can make a huge difference to someone just to independently pour their cup of tea. So it's really, really important that if anyone's living with sight loss, that they have that needs assessment done with the sensory impairment team, so that any appropriate aids and adaptations can then be provided. So instead of, going and buying something, the person might think, oh, that might help, that might help. Actually, the best thing to do is to get that referral, an assessment done with the person's consent, and then that way they've got the most appropriate aids and adaptations recommended to them. Then, of course, you've got low vision clinics. Depending on your area, it may well be in the hospital, it may well be in an optician's in the community. And that's where someone may be provided with a magnifier, for example, or some other low vision aids. There's lots of other aids and equipments available as well, but as I say, the best thing to do is to have that needs assessment done by the sensory impairment team as well. And then, of course, there's things like talking books, the RNIB library, where if someone's unable to read your standard print now, of course, there are books available in larger print, giant print, audio versions, so the person can still enjoy their books. And even some people without sight loss, still find that actually audiobooks are enjoyable as well. So talking books and, of course, Braille versions for some people may be suitable too. Tech support, oh my goodness, how advanced is technology nowadays, but there's, again, so much out there in relation to tech support. We have a Technology for Life team in RNIB who can provide support to people as well living with sight loss. And it may be something like, using their phone, for example, an app in their phone that has a magnifier on it, and that just helps them read their mail independently. It could be, small pieces of support like that can make a huge difference. And then there's other groups, and there's connect services where people can have that sort of peer support as well and connect to other people who are living with sight loss, which can have a huge impact, of course, just having that peer support as well. So I'll put the links up in the chat to many of the different things that I've mentioned there today as well. But there's also a sight advice frequently asked questions website that again has lots of information on it. And then, of course, the Sightline directory would give you what's local to you, what's available to you as well. But there's lots of support and services out there. Just catching up with the chat here, Kate said, how would you find them? Was that, sorry, Kate, what was that in relation to? Was that the ECLO?
Yeah, you answered it just as I typed it.
Oh, that's great.
Perfect.
Perfect. Thanks, Kate. That's super. Good. So that's really, has covered a lot of the different areas today that Vicky asked me to come along and discuss with you. But I hope you found that useful, helpful, and any questions at all, feel free to pop up in the chat or shout out just now. And we appreciate any feedback at all as well. So I'm going to pop up a wee link to our evaluation, and we really appreciate any feedback. You can either just scan the QR code just now if you like your technology, use your phone camera, but I'll also put the link up in the meeting chat as well. But I hope you all found that useful, and thank you everyone for attending and listening to me this morning. Thanks very much.
Thank you, Lindsay. That was really useful. Does anyone have any questions at all? No, I think, Lindsay, that's been brilliant. So much information. So I'll put this up on the forum so that people can view it in their own time. We've obviously got all the links. So that's brilliant. So thank you everyone for attending, and thank you, Lindsay, for a brilliant presentation.
That's super. Thank you so much. I'll just pop up the link to the evaluation. That's okay, Vicky. And
absolutely
the links to everything else that I've just spoken about there. There's a lot of information. So hopefully the further links will help as well. Okay, so that's the evaluation link up there now as well. And then I'll just pop up all the other links that we've discussed there too. And I'll send you it through email as well, Vicky, so you can share it that way as well.
Yeah, that would be great if we could have just the presentation as well. That'd be great.
Yeah, that's fine. I'll do that as well. Oh, thanks for all your lovely messages as well. That's really kind of you. Thank you. That's great. Super. Good, so that should be the links up there now as well. But yeah, if anyone's got any questions, feel free to ask. All good. Good.
There will be a talk in a month's time on running reports, but I'll send that link out separately to everyone. But other than that, have a great day.
Super. Thanks, everyone.
Take care.
Bye.
Thank you. Bye.
Thank you, Lindsay.